Hello everyone, we will study Chapter 40, Tumor of the Surgery. Let's first review such contents as tumor overview and treatment principle of oncological surgery, and then study common body surface tumor and masses. A tumor is a new organism formed by proliferation and abdominal differentiation of human cells under the action of various initiation and promoting factors. By biological behaviors, tumors are divided into benign tumor, malignant tumor, and borderline tumor, between benign and malignant behaviors. Biological characters of malignant tumor include cellular differentiation and abdominal proliferation. Its growth is not subject to growth organic regulation. It invades peripheral normal tissue and causes metastasis and other consequences. Malignant tumors derived from epithelial tissue are medically called cancers, such as lung cancer, gastric cancer, and breast cancer. Malignant tumors derived from mesenchymal tissue are called sarcomas, such as liposarcoma and osteosarcoma. Embryonal tumors are called blastomas, such as neuroblastoma and retinoblastoma. Tumors or disease that are used convenience name, such as malignant myeloma and leukemia, and basically malignant tumors. Cancer called by people in daily life are malignant tumors. Etiologies of malignant tumors are still unknown. Initiating and promoting factors that act on human cells are external causes. The mutation of cell gene, including inactivation of tumor suppressor gene and activation of proto-oncogene, is internal cause. Such causes finally cause abdominal differentiation and proliferation of cells, not just to normal organic regulation. This is occurrence of tumor. It is found epidemiological investigation and clinical observation that environment and behavior have important influence on the occurrence of malignant tumors. External factors include chemical, physical, and biological factors. Internal factors include gene, endocrine, and immuno factors. It is found in relative current studies that personality is also an important factor affecting the occurrence and development of malignant tumors. People with personality traits of often suppression of their emotions are more likely to develop malignant tumors. Some scholars call this personality cancer personality, that is, abnormal expression and regulation of negative emotions. The diagnosis of malignant tumors, like other diseases, depends on clinical manifestation, physical examination, laboratory and imaging, and other auxiliary examination. Clinical symptoms are associated with tumor malignancy, site, and development. At present, pathological examination is a direct and reliable basis for the determination of tumors. Tumor is categorized by natural exfoliated cells, mucosal cells, suspicious cells, extracted by fine needles, and suspicious tissues, resected by punctures, forceps, and surgery. In the early stage, some tumors show no obvious symptoms, or symptoms are not characteristic. The best treatment time may be missed if a tumor patient does not pay much attention to seek medical treatment. Therefore, regular physical examination and timely medical treatment in case of physical disfigurement are of great significance for prognosis of malignant tumors. The TNM staging method proposed by Union of International Cancer Control is a widely used staging method and present. T. Primary tumor. N. Lymph node. And M. Distant metastasis. After T and M, the degree of tumor development is indicated by a number. 0 to 4 after T means the local invasion depth. 0 to 3 after N means the metastasis degree of lymph node. In case of 0 to 1 after N, M0 means no distant metastasis. M1 means there is distant metastasis. The stage of tumor is determined by set 3 items. Specific criteria for TNM classification of various tumors are agreed upon professional conferences. A malignant tumor is caused by integration of many factors. There is no single effective preventive measures at present. UICC believes that 1/3 of malignant tumors can be prevented. There is a hope of clinical cure of 1/3 of malignant tumors if they are diagnosed early and treated early. Pains can be relieved and survival can be prolonged for rest 1/3 of malignant tumors. UICC has put forward a concept of 3-level prevention of malignant tumor. 3-level prevention of malignant tumor. Primary prevention is to eliminate or reduce factors that may cause cancers. Secondary prevention is to early discover and promptly treat malignant tumors. And tertiary prevention is the rehabilitation after treatment to improve the life quality of patients and prolong the survival time. About tumor treatment, at present, benign and borderline tumors are mainly restricted by surgery. Borderline tumors must be completely resected. Otherwise, they are prone to recurrence or malignancy. A malignant tumor is systemic disease. The conventional treatment method may include surgical treatment, chemotherapy, and radiotherapy. At present, tumor-targeting therapy and immunotherapy are under fast progress. The application of TCM is malignant tumor treatment is increasing day by day, and TCM is a hotspot in the research field of malignant tumor at present. Specific treatment programs for malignant tumors should be discussed by multidisciplinary physicians, as malignant tumors, in addition to local damage to tumor site, will produce systematic damage symptoms, such as cachexia. The Tumor Treatment Center, composed of such departments as oncological surgery, internal medicine, radiology, imaging, pathology, and so on, is also a multidisciplinary cooperative diagnosis and treatment mode adopted by more and more hospitals at present. This mode surely realizes patient-oriented. For many malignant tumors, there are specific standardized treatment guidelines. The guide physicians to develop individualized treatment programs for patients and may regularly revise the guidelines based on feedback on treatment outcomes. Surgical resection of tumors is still the preferred treatment for most early and earlier solid tumors. The development of a tumor is a long process, and surgery can be used at different lesion stages. The tumor stage can be correctly determined with all kinds of examination before surgery. They are helpful to estimate the extent of surgical resection. In addition to conventional surgical operations, the treatment methods such as laser, endoscopy surgery, heating and freezing, microsurgical technique, organ transplantation, and other advanced methods have been carried out. Such methods greatly reduce the complication after tumor surgery, and the patient achieves better treatment results. Surgical treatment is a local treatment that does not prevent hematogenous metastasis. Therefore, the treatment of a tumor must depend on the different biological behaviors of the tumor. Some tumors are prone to lymphatic metastasis. The surgery should include a complete resection of the primary lesion and regional lymph nodes. Some tumors are prone to hematogenous dissemination, and even if the extent of tumor is expanded, the therapeutic effect is not significantly improved. According to its application purpose, surgeries of oncological surgery can be divided into preventive surgery, diagnostic surgery, radical surgery, palliative surgery, and reduction surgery. These surgeries of different purpose are interpreted in technical material. You can study them by yourselves. Next, we will focus on the treatment principle of oncological surgery. To carry out tumor surgery, basic principle of oncological surgery shall be followed in addition to the general principle of surgery. Attach importance to all-round examination before surgery. Examine primary and metastatic lesions of tumor in all-round manner. correctly understand the pathology diagnosis, perform intraoperative frozen section examination to determine the surgery extent, judge the clinical stage of the tumor, T&M, attach importance to biological characteristics of tumor, resection extents of tumor of different natures. For example, the skin basal cell carcinomas in the body surface tumor needs local wide resection and generally does not require lymph node dissection. However, malignant melanoma needs wide local resection and requires regional lymph node dissection. Attach importance to multidisciplinary collaboration. I have mentioned that intervention, chemotherapy, and radiotherapy departments should be collaborated to provide the most reasonable treatment program for patients. For example, preoperative neoadjuvant radiotherapy and chemotherapy, post-operative radiotherapy and chemotherapy, adopt comprehensive treatment and individual treatment. Emphasize on surgical standardization, 2-max minimization principles, maximum resection of tumor and maximum protection of normal tissue and function. Adequate resection extent should be included. Primary focus and adjacent normal tissues or affected regional lymph nodes, resection of affected adjacent organs, complete resection of biopsy area and tumor status. The most important concept in oncological surgery treatment center is the concept of non-tumor technique. Its basic idea is to prevent the tumor cells from exfoliating, planting, and hematogenous metastasis during the surgery. The non-cutting principle means that the tumor tissue is not directly cut during surgery, just dissecting from the periphery to the center, and all options are performed in the normal tissues of the primary cancer. The en-bloc resection means that continuous en-bloc resection is performed on the primary lesion and regional lymph node rather than separate resection. The non-tumor technique means that the tumor is not touched in all operations, including local metastatic lesion. Specifically, 1. Examine the tumor gently and avoid squeezing and repeated examination. 2. Avoid inoperative local treatment of tumor. 3. Perform a curative surgery as soon as possible after biopsy. 4. Do not use local anesthesia as far as possible. A certain distance shall be maintained from local anesthesia to tumor. 5. The excision can fully expose the tumor. 6. Explore from distance to nearby site and operate gently during surgery. 7. Sharp dissection. 8. No-touch isolation technique and en-bloc resection. Next, we will study common body surface tumors and masses.